Hello, and thank you for joining me this evening for the award ceremony for the first European Patient Digital Healthcare Award. My name is Paul Robinson. The PDHA Award started in 2018 by my Italian colleagues to recognise innovation in digital healthcare. But uniquely, the judges of this innovation were the patient organisations and patient representatives themselves. And so it's critical to build the link between the innovations that are being brought forward by the digital entrepreneurs and the needs of patients and their caregivers to make sure that what comes forward meets their needs. This year, we've decided to extend the programme to the European level, and I'm delighted that we've had 64 applications from 13 different countries across the European Union, the European Free Trade Area, the Balkans, and the United Kingdom. The agenda for this evening's meeting is to start off with 3 talks, which will be given by representatives of patient advocacy organisations. It's important for us to hear from them what's on their agenda, what challenges they're facing, and how they see this new digital world being integrated with the needs of the patients that they represent. We'll then hear from Deepak Khanna, who is the Vice President for MSD in Europe. And I think Deepak will address how important it is that all stakeholders are brought to the table to make sure that we bring innovation to meet the needs of patients, and in particular, to make sure that we have a favourable policy environment. The 4 categories of the awards consist as follows. Firstly, digital innovations that help in the diagnosis or prevention of disease, in mental health support and in social health support. The second category is for digital innovations that link the patients with their healthcare professionals in a remote manner. And this is particularly important in this COVID year, where face-to-face consultations have obviously been significantly reduced. How can we make sure that patients still get the benefit of their healthcare advice? The third category tonight is about disease monitoring and therapeutics. So once a patient is on a treatment, how do they manage the effect of that treatment? How do they know that it's doing them good? How do they know to go back and ask for help when it doesn't seem to be working? And then finally, we have a category about returning to care after COVID. Clearly, COVID has taken front stage for many, many hospitals and healthcare professionals this year, but that means there's a large number of patients out there whose conditions have not received the attention it needs. They've not received the preventative health care that they need. And so the 4th category is specifically about getting those patients back into the care that they need using digital technology. The results of the 4 categories are going to be announced by some of my patient advocacy colleagues who've been on the judging panel, along with some digital entrepreneurs who have made the decisions. And then finally this evening, hopefully we'll have a wrap up and some key take-home messages. So let's hear first of all from some of my patient advocate colleagues.
Thank you very much. At Allied for Startups, we're thrilled to be partners of the Patients Digital Health Awards first ever European edition. It's a unique opportunity to spotlight some of Europe's best digital health innovations, improving the health and quality of patients and caregivers. I'm Benedict, I'm with Allied for Startups. Allied for Startups is a global umbrella of startup organizations ranging over 45 members across 4 continents. Our mission is to give startups a voice in the policy making that affects them. And actually, since over 2 years, we've been looking more closely at the health vertical with our digital health project. The goal here also is to make sure that we can get the most from our digital health startups across Europe and the world. Obviously, COVID-19 has impacted our ecosystems profoundly, but we also witnessed these digital health startups rise up and deliver during this extraordinary period. Think about access to telemedicine, mental health platforms, remote care tools, or the contact tracing apps, which we all are so used to using right now. Startups have played a vital role and still do in empowering patients and getting us back to normal. And from our perspective, it's not a coincidence that startups are so central to innovation for patients. Health startups are patient-centric in their nature. It runs in their DNA. As we've seen with the impressive number of PDHA applicants, the most cutting-edge healthcare technologies are those created central to the needs of the patients. And we've seen more and more that there's been a shift in redefining the patient role from that of a passive recipient to an active and a collaborative patient. The EUPDHA awards are therefore catalysts in recognizing innovation from a patient perspective and applauding, putting the spotlight on solutions that improve the quality of life of patients and caregivers. We are therefore super proud to see startup innovation being rewarded today. Startups are showcasing their problem-solving abilities in reaction to these new challenges we face, all while remaining true to their users and patients. We are looking forward to inviting all winners of the EUPDHA21 to our Startup Summit in Brussels to continue the discussion on what we need to make sure these great ideas and these great startups are scaling across Europe and the globe. We are thrilled to be a part of this project, and I'm passing on the floor to the next speaker. Thank you very much.
Hello, my name is Cecilia Bonefeld-Dahl. I'm the Director General of Digital Europe. Thank you so much for inviting me to the jury of the European Patient Digital Health Award. I must say that the submissions this year were super exciting. I'm excited to see how Europe really has a network of innovative tech health companies, of researchers and scientists. There is a lot of work to do on digital health. The pandemic has really shown us that data and digital is at the heart of future healthcare. During the pandemic, we know that 90% of the caregivers needed to reduce their healthcare services, and that 50% of patients with cancers and diabetes live through disruptions in their treatments. This is absolutely unacceptable. We need to be able to provide healthcare at all times to our citizens and keep them safe. Data and technology plays a major role, not only in delivering the healthcare services, but also in preventing and treating future diseases. Every year, each European country nominates a digital scale-up for the Digital Europe Future Unicorn Award. The award recognizes the most brilliant digital scale-ups. And actually, the last 2 years, winners have been health tech companies. Corti from Denmark and OnCompass from Hungary are both using artificial intelligence to improve healthcare. So AI is already being used to save lives, to detect diseases, to invent vaccines much faster than before. A huge amount of health data is a part of the solution. Today, many scientists, many companies struggle to get data enough to make sure that they can do their innovations. And Digital Europe really wants to do something about this. So data is at the heart of health innovation. Actually, health data makes up 30% of the world's stored data, but a lot of it cannot be accessed and cannot be used. And not least, it cannot be shared across border. And as we all know, COVID and other pandemics and diseases do not care about borders. So we need to give access to data. This is why the European health data space is so important. We know that you, all the innovators of Europe, need data to improve healthcare, to improve vaccines and treatments. During the pandemic, we have seen European governments collaborating on COVID app, COVID certificates, and on infrastructures to deliver exchange of patients' information. Is that the groundwork done for a true health union, where we have a harmonized internal market for digital health? We can only hope so, and Digital Europe is ready to collaborate and ready to put efforts into making this happen. Looking at the nominees of this award, I must say that we do have what it takes. We have innovative talent. We have all the researchers, the innovators, the companies that are ready to deliver these solutions. So I just wish to say, keep up the good work. I will work on the political scene to make things happen. And I hope that you will keep on innovating. Stay safe, stay digital, stay innovative. Thank you.
Good afternoon, everyone, and greetings from Rome, Italy. My name is Mariano Votta, and I am the Director of Active Citizenship Network, the European branch of the Italian NGO Cittadinanza Attiva, where I'm responsible for European affairs. Cittadinanza Attiva is an organization founded in 1978 whose main goals are the promotion of civic participation in the policy-making process and the protection of citizens' rights in Italy and abroad. So when we talk about health, we talk about patients' rights. Passionate about healthcare and consumer issues, I have more than 20 years of experience in the field of advocacy, stakeholder engagement, communication, policy dialogue at the European level, where I took the initiative, for instance, to encourage and officially launch the so-called Member European Parliament Interest Group European Patients' Rights and Cross-Border Healthcare at its second mandate right now, promoted with the endorsement of almost 100 organizations across Europe, citizens and patient organizations. For instance, from their account of the pandemic, it emerged a story that tell us about the great reforming force of civic organization and patient advocacy groups, capable, for instance, of responding promptly to new needs by managing services, building alliances, quickly signaling necessary normative or procedural changes, mobilizing resources, both human and economic, innovating the way it works, and introducing and promoting practices from which it will not be necessary to go back when everything will be over. At the same time, to be honest, from the account of oncological and chronic patients during the pandemic, it emerged also how they have been left almost alone for a while, for several months, a situation that jeopardized 20 years of care and prevention. It was not acceptable at all, simply closing health services, so alternative solutions are needed. For instance, reading the recommendation sent by civic and patient organizations to the European and national institutions, for instance, in occasion of the Global Health Summit last May, or the most recent G20 Health Ministers meeting led some days ago at the beginning of September, we can find, among the others, the need to better monitor COVID-19 impact on non-COVID-19 patients, to support the digital healthcare transition, to affirm a life course approach for chronic disease prevention, to better address the specific rights of patients living with comorbidity. Well, as a jury member of the Patient Digital Health Awards initiative, I had the pleasure to be much more aware about a relevant number of health digital solutions, more than ever crucial towards a more resilient healthcare systems. Able this kind of solution, for instance, to facilitate the communication between healthcare professionals and patients, or to remotely monitor some specific health indicators, or to better guarantee therapeutic adherence. In a word, we can say useful tools in line with the patient's need and their recommendation. For this reason, I strongly believe that the potential of the European version of the Patient Digital Health Awards is huge. And my wish for the organizers is to continue to invest on it, developing the initiative in at least 3 directions. For instance, starting from the database to build a community, to create and feed an European network of good practices managers, experts on digital health solutions. Secondly, starting from the analysis of the digital health solution collected, I suggest to draft a policy recommendation to be addressed to the institutions and relevant stakeholders in order to better guarantee the patient's right to access to care and the patient's right to innovation, represented this kind of innovation by the best practices awarded. The third direction could facilitate the dialogue between the startup, the new healthcare providers with the civic organization and patient advocacy group. Also because in the most of cases, this kind of relationship is still to be built. The aim is to identify a common platform to better cooperate at European level in terms of protection of patients' rights, in terms of introduce and access innovative solutions, in terms of sustainability, in terms of more resilient healthcare systems. Of course, my organization, Cittadinanza Attiva, and our European branch, Active Citizenship Network, will be happy and ready to cooperate. I want to thank you for the attention, and I'm very happy to introduce the next speaker.
Thank you so much, Benedict, Mariano, and Cecilia, for those inspiring talks. It's important that we remember the role of the patient in everything that we do. So now I'd like to go on to introduce Deepak Khanna, and I'm hoping that Deepak is going to talk to us about the importance of multi-stakeholder involvement in the quality of healthcare initiatives, because it's only by bringing everybody to the table that we will end up delivering the best deal for patients. So Deepak, over to you.
Thank you, Paul, and it's great to be here. Good afternoon, ladies and gentlemen. I am Deepak Khanna. I am the president of the UCAN region for MSD and Merck, and I am delighted to join this award ceremony today. You know, as the global health emergency that the entire world is fighting has clearly demonstrated, that there is a growing need for digital health solutions. So I am very, very thrilled to support the European edition of the Patient Digital Health Award. You know, 4 years ago, I was very, very excited to see how this amazing initiative started. It was created and launched by the MSD Italy Foundation and the Digital Health Academy in collaboration with a number of Italian patient associations. I think when it started, there were about 30 in the first edition, and now there are more than 50 different patient associations supporting this. So over the last few years, patient associations have scouted more than 150 different innovative digital health projects that play a huge role in a very important role, a very positive role in improving patients' lives. So it's just great to be able to see this. And today I'm very, very happy to welcome the first European edition of the Patient Digital Health Awards. You know, as a healthcare organization, it's our responsibility, together with all of the stakeholders in the ecosystem, to ensure that all patients in Europe get access to the care that they need. And at MSD, we want to make sure that there is a human connection between the patients and us, because we're people that care about the needs and concerns of patients. And it's no surprise that our judging panel today is comprised of patient organization leaders, alongside digital innovation experts. So I want to thank them all upfront for all of their hard work in reviewing all of the excellent submissions that we have for the PDHA awards this year. You know, listening to the patient voice and experience, as well as engaging patients in digital innovation process, is critical for digital health tailored to patient needs and their perspectives. So it's really important that we continue to hear the patient voice and we continue to engage them through this process. And when you step back, our healthcare systems have been put to the test during the COVID-19 pandemic, and they continue to be at their limits as we battle against the virus, and that battle is still not done. So for example, when you think of cancer care, and you think of cancer, which is responsible for 1 in every 4 deaths in Europe, making it the second leading cause of death and disability after cardiovascular disease, many of these services have been restricted because of COVID-19. And I think digitalization of health services offers us new opportunities to maintain access to care without compromising on standard or quality of that care. During the COVID-19 pandemic, the use of digital tools in healthcare increased dramatically, from teleconsultations to the utilization of chatbots, AI assistants, mHealth apps, e-prescription tools, data sharing solutions, and many others. Doctor visits have been turned into virtual meetings with more flexibility on both sides. Some testings and some screenings have even been turned into digital. But nonetheless, COVID-19 also unveiled the limitations of digital health. The emotional difficulty exchanges that we have, they can't be done virtually. You can't have that on a virtual web conference. Digital exchange requires us to do a lot more. It requires us to have digital literacy and simply up-to-date equipment to be able to make this work. And a lot of this is challenging for many people, whether it's the elderly or people that are low income or people that have a low level of education. So there's a lot more work that we need to do. And I think by creating a bridge between the patient community and the startup ecosystem, the European Patient Digital Health Award Initiative creates the space needed to address the challenges and opportunities of digital transformation of healthcare. And it helps us develop a common vision. It helps us really identify what needs to be done to bring digital innovations closer to people, to ensure that the digital and access gaps get smaller, not larger. So I'm very, very proud of this year's edition of European Patient Digital Health Awards, which has seen so many inspiring projects led by highly motivated innovators from all parts of Europe. And like many things in healthcare, the digital experience is a journey. And I look forward to continuing to work with all of you in the years to come. Thank you.
Deepak, thank you so much for those inspiring words. What I'd like to do now is to just take you through the 4 categories of application that we have in this year's award so that you understand what it is that we're trying to recognize and reward. The first category is about disease prevention and early diagnosis. Clearly, prevention is better than cure in almost every circumstance. And if patients can understand what habits they have that they can improve, if they can screen themselves for prevention and for diagnosis, then that has to be a good thing. And so that category will reward applications that allow patients to take self-control of their condition, their risk factors, and really motivate them to prevent disease taking hold and allow them to lead healthier lives. The second category is about new ways of interacting with your healthcare professional, and this is about shared care. Clearly, COVID has meant that face-to-face consultations have been less common than we would have liked, but actually it's given us the opportunity to take responsibility of our own illnesses and our own care. But to do that, we need to communicate with our healthcare professionals. And so applications that allow us to exchange messages with our healthcare professionals, to join events, to receive training, send messages, share data, all of those things must be a good thing, and we're looking to recognize some of those. Then, of course, if a patient has established disease, then that disease needs monitoring and it needs oversight. And so we're looking to reward applications that allow patients to document what's going on. It allows them to understand whether there's progression in their condition or not. It allows them to understand whether they should adjust their medication, and in particular, whether things are going downhill and they may be heading for an acute admission to hospital. They can take steps to avoid that, which clearly is desirable. And the final category is about returning to care after COVID. Clearly, this last year or two has been very difficult. COVID has taken first stage for many healthcare systems, but that means there are millions of patients out there whose conditions have been suboptimally treated. And it's important for those patients that we get them back into the healthcare system, we get their preventative healthcare back up to date, we get their diagnoses checked and into treatment as quickly as we can. And that needs to be done with the involvement of digital healthcare systems. And so that's a special category for this year that we're looking to reward. So the results are going to be announced by members of the judging panel. And I'm delighted to hand over to some of the members of the judging panel to tell us who the winners are for this year.
Hello, everyone, and welcome to this award ceremony. Thank you to Paul Robinson for passing me the floor. I am Antonella Cardone, the director at ECPZ. ECPZ is the European Cancer Patient Coalition, which is the largest cancer patient umbrella organization in Europe, with over 450 members, and we cover the whole of Europe, plus at least one member per continent. We work for a Europe of equality, where all cancer patients have the same timely access to the quality of care, no matter where they live or were born. So it is now with my great pleasure announcing the winner for the area of focus, digital prevention and diagnostics, mental health and social support.
Thank you very much to the panel for this nice introduction and for choosing our project. This is an enormous honor for us, especially as a company that was created by patients, actually by the family of one specific patient, my son Biel. My name is Jaume Puig, and I'm an electronics and telecommunication engineer, an MBA, and the CEO of Biel Glasses, a company based in Barcelona that creates digital smart glasses to improve the autonomy of the visually impaired. Our project started with my son Biel. Biel was born with a disease that causes him low vision. When Biel was 2 years old, realized that something was wrong with him, with his mobility. He took a very long time for him to learn to walk. And actually, when he learned to walk, he was still having a lot of falls, and he had a lot of difficulties for descending the stairs, and he easily got lost. So after visiting many doctors, we realized that the problem of Biel was in his eyes. And then we knew about something completely new for us, which was low vision. Low vision is a visual impairment that is not a complete blindness, but do not let you do the basic tasks for carrying out your life, and cannot be fixed with glasses or surgery or other medicines. The worst consequence of low vision, especially when you have peripheral vision loss, like in the case of Biel, are the mobility problems that cause accidents, dependency, and isolation. But people with low vision, they still see. They still keep some visual capacity. This is why my wife and I, my wife, she's a medical doctor, and I as an electronic engineer, when we realized that there was no solution in the market for Biel, we started to think of a solution to help him at least to be more autonomous, to adapt the reality to this visual capacity in order that he can move around alone, especially when he was going to grow old, to grow as an adult, and will not have me and his mother to accompany him to do whatever he wants to do. So then we created Biel glasses. And Biel glasses are smart glasses that are based in AI. We use AI and robotics to understand the scene. And then we use mixed reality, which is a combination of virtual reality and augmented reality, to show the risks that there may be in the scene, like obstacles or crossings or traffic lights, in a way that the patients may understand, may perceive with their remaining vision, in order that to solve their mobility problems and to let them be autonomous and any other. But besides talking about our project, I would like to talk also about today as being awarded in this with this prize to talk about patient innovation more generically. We think that patients are very qualified to innovate in health, as we detect the limitations of the existing solutions and the gaps of the health systems, because we directly suffer them. As patients, we can give a completely different point of view. We are more likely then to create disruptive innovations because, as Einstein said, everyone knew that it was impossible until a fool came and did it. For example, in our case, in the beginning, we were told that what we wanted to do for BL was impossible because the available technology, when we started the project, was not able to provide the real-time computing capacity to understand the scene in real time and doing it within a wearable device. But as when we came back, after being told that it was impossible, when we came back to our home, the problem was still there. We waited. We started to work in the conceptual design and in the algorithms that we would need to use. And then we waited until the robotic processors were available. And then we could start developing and creating the product, the solution that we wanted for BL and for the people like BL. So as a final remark, I would like to ask today, which is a happy day for us that we have been awarded, but we want to ask for more help. And we want to ask to all the institutions and stakeholders in healthcare innovation to give more support to patient innovation. As I said, we feel we are very proud and we feel as somehow as representatives of patient innovators today here. And then we represent the patients and the patient families that are struggling to create solutions for their unmet needs. Most of the time, especially when it comes to research and innovation grants, the patient innovators have to work on paths created for very different people, companies, or institutions, where we are evaluated with parameters that do not match our capabilities. We believe that the digital transformation of healthcare is not only about how digital technologies can be used to create new healthcare solutions, but also about how these technologies are to open up the healthcare system to patients and to let them have much more active role in improving health. But technology itself is not enough. We also need to transform, to make this transformation happen and to open it to the patients. We also need the involvement of the institutions that manage innovation in healthcare to make this possible. So that's all. Thanks again for the panel members for choosing our project as the winner of this contest, and for the PDHA team for the organization of these awards that are so important to raise awareness about patient innovation, and to all the sponsors and supporting institutions. It's very important, what you're doing is very important, and thank you very much for doing it. Thank you and goodbye.
Congratulations to the previous winner. I'm Antonietta Pannella, and Marketing Communication Director at Healthcare Group and one of the founding advisors of the Digital Health Academy that is a partner of this great initiative. I'm really proud to announce the winner of the Disease Monitoring and Therapeutics category. And the winner is
Hello, everyone. My name is Nina Sesto. I'm the CEO of Maggie Digital Health Startup and a Director of Digital Health at Magdalena Clinic for Cardiovascular Diseases. It is a great honor to receive this award and such a recognition from European Patient Digital Health. And I would like to express my biggest thanks to the jury members for their support. For us, this is an important milestone and confirmation that we are on the right track, as patients have been in the center of our activities since the initial stages of our company. And our vision is to bring care to every patient home. And why? Because we live in an aging society where 80% of the population older than 60 have at least one chronic disease. And the healthcare system simply failed to provide adequate care to the growing number of chronic patients. There is a lack of capacity. And this leads, of course, to poor treatment outcomes, long-term disability, premature death, and escalating healthcare costs. European governments spend more than 700 billion euro each year on chronic disease only. Take, for example, hypertension, high blood pressure. In the past 30 years, number of people who suffer from high blood pressure doubled to 1.28 billion. And less than 1 in 5 have hypertension under the control. Taking into account that hypertension is relatively easy to diagnose and cheap to treat, this is the biggest public health failure of our century. And on a mission to help 700 million people who are seriously ill, we developed Maggie, a daily health companion who provides diagnosis and chronic care to hypertension patients 24/7. Maggie was born in an actual clinical setting within Magdalena Clinic for Cardiovascular Diseases, in close collaboration between our patients, AI experts, cardiologists, and psychologists. And her brain consists of medical expertise as well as the capacity to handle interpersonal relationships with patients intuitively and empathetically, ensuring patient engagement and high adherence to the treatment. So how does it work? Maggie speaks with patients on a daily basis using a messaging app, and integrated with the blood pressure sensor, she uses personalized protocols to recall patients to take their medication and measure their blood pressure, as well as educates them about their lifestyle with their disease. Maggie algorithm is based on 7 different behavioral modules that reflect the patient's medical condition and course of the treatment. Likewise, patients can report to Maggie any adverse symptoms or high blood pressure values, in which case she calms them and guides them until blood pressure values stabilize. At the back end, Maggie uses complex algorithms to analyze clinical data and behavioral data in real time. And in case of unregulated blood pressure values, Maggie alerts the doctor and schedules an online consultation where doctor directly communicates with patient, confirms its clinical status, and can correct the antihypertensive therapy. In addition to collecting clinically valuable data, Maggie supports patients, easing their daily life with a chronic illness. Namely, research has shown that one of the main causes of adherence to therapy and doctor's recommendation is precisely the wrong prejudice and misunderstanding of one's own illness. Thus, Maggie, as a representative of health system, takes on the role of educating patients, reducing their fear, and achieving much greater adherence to the recommendation of blood pressure measurement and therapy. Our clinical pilot showed a success with 98% patient adherence to Maggie monitoring. Such a high adherence of patients to Maggie not only shows how much patients love Maggie, but brings a large amount of health data that are statistically and graphically processed, which allows doctors to make decisions about further treatment with much greater certainty and accuracy. Our results show that with the use of Maggie, the time required for a physician to gather information from patients during an examination is shortened from 15 to 4 minutes. And the antihypertensive therapy adjustment itself is shortened from 6 months to 3 weeks. And the real magic of Maggie is that when she learns how to manage one patient, she can manage thousands of patients simultaneously for literally no cost without creating an additional burden to doctors. And how Maggie learned about hypertension, she can learn about any other disease area. So we do have a powerful tool in our hands to exponentially increase the capacity of healthcare, transforming patients from passive bystanders to active participants in management of their own disease, for better quality care that automatically translates to cost reduction. So this is a three-win game for patients, healthcare providers, and insurers for sustainable future of healthcare.
Congratulations. It's Benedict again. And now it's my great pleasure to announce the winners for the area of focus, new ways to interact with healthcare teams and providers. I'm passing the floor to the winners. Congratulations.
Hello to everyone. We are very grateful for this award as it is a recognition of our commitment with patients, not only focusing on improving their quality of life, but also doing it in this new digital era. So we want to thank the entire MSD and Digital Health Academy team for this opportunity. My name is Ana Gomez and I am the Patient Affairs Manager at Legit Health. Legit Health is a medical device for doctors and patients based on computer vision and deep learning algorithms, which permits the detection of more than 232 different skin conditions, including acute, chronic, and malignant pathologies, and it calculates automatically each scoring system according to each pathology. This contributes to speed up the process of both diagnosis and follow-up, helping to determine the severity of the skin lesion just by looking and analyzing pictures reported by patients themselves remotely. Skin diseases are among the most common health problems worldwide and are associated with a multidimensional burden that includes psychological, social, and financial consequences on patients and their families. Due to the difficulty of the access to the specialized care, influenced by the shortage of dermatologists per capita, among other reasons, patients are seen by primary care providers which have less knowledge about dermatology. This not only results in an increase of time to diagnosis, but this also causes the misdiagnosis of common skin conditions such as eczema or psoriasis. In consequence, patients do not have the right treatment or the right follow-up according to their pathology or their severity, and they suffer for years until they are referred to a dermatologist. This referral process is usually both a bottleneck for the medical center and also a source of frustration for patients and doctors. Whether or not to refer a patient to a specialist is a very complex decision that lives at the core of the way in which healthcare teams interact. Legit Health is deploying pioneering severity estimation artificial intelligence to aid general practitioners in the process of referring patients, not only helping in that decision making by extracting how much the patient fits the criteria, but also automatically shares contextual knowledge with the general practitioner that is commonly only in the mind of the specialist. This way, Legit Health is a breakthrough solution in new interaction models that allows knowledge sharing, event management, learning, and communication methods to support doctor-patient relationship. This is possible thanks to an innovative solution that includes deep learning, few-shot learning, big data and analytics, cloud computing, and automatic processing. And last but not least, this is a patient-centered solution that leads to a better quality of life by helping to have the right diagnosis, the right treatment, and the right follow-up at the right time. Moreover, the information given to patients in the app allows them to have a better self-knowledge about their pathology and their evolution, and make them feel more autonomous and empowered to report and share information with their doctors, which also makes them feel more accompanied. The most remarkable items of Legit Health value proposition are improving tacit communication between health professionals and patients, helping to detect multiple skin pathologies at the same time and automatically track the evolution. Patients feel cared for and accompanied in their illness, and it improves patients' remote care experience. Finally, I would like to finish mentioning that taking into account that from 30 to 70% of the population will suffer from some skin disease at some point of their life, this is a huge problem with a great impact in our society. Therefore, at Legit Health, we want to contribute to being part of the solution, not only from the clinical point of view, but also for the emotional and psychological well-being of this patient. Once I heard that we have to focus and use our passion to make an impact, and this is what Legit Health does. Thank you once again for this opportunity and this award, and stay safe.
And finally, let's come to the award for this special award in this COVID year for returning to care during the COVID environment. So let's hear from the winners.
Hi, my name is Megan Lever. I'm the co-founder of PEP Health, that's the patient experience platform, and I'm delighted to be here today. Thank you so much for this award. We're really excited to be part of the celebrations at PDHA this year, bringing our technology to the European market. So a little bit about what we do. So I'm co-founder. My background is as a psychologist. So I spent several years studying health systems, and particularly interested in understanding how we can take the patient voice and patient feedback and utilize it to improve the quality of care in our hospitals and improve the effectiveness and dignity of care, particularly during COVID. So a little bit about what we do and who we are. In 2018, we started PEP Health. We are a UK-Dutch SME founded by two healthcare leaders, myself and my colleague Alex Griffiths, who's the data scientist, so does a lot of the algorithmic wizardry that sets up our technology. And we really envisaged a better, faster way of listening to patients across a geography, whether it be in the UK where we're based or anywhere else across Europe. So what is it that we do? We have a unique IP and AI technology that generates practical real-time insights about what patients really think about their care. We are data source agnostic, so we look at social media data, so reviews left on Google, reviews left on Facebook, Twitter, as well as internal surveys. So we can also collect the internal data that hospitals are collecting about what patients think about their care. We bring all of that data together, and our first algorithm just looks at whether or not that's relevant to the quality of care. Then we tag it by location and department, so whether or not it occurred at the hospital level and in which department it occurred in, so A&E services or urgent care, or did it happen in maternity services. From there, we tag it by 8 internationally recognized quality domains. So a lot of these domains are really familiar, such as fast access. How was the actual access to care received by the patient? Was it effective treatment? Did patients feel that they really had a say in their involvement and preferences for their care? So each of the comments is tagged in this way. And then we take all of that data and put it into a dashboard. So healthcare managers in the hospital, whether it be clinical or organizational, are able to have that data at their fingertips in real time. So this enables hospital managers to really understand what's going on at their hospital level, as well as benchmark across all of the hospitals within the same geography. So currently in England, for example, we have all of this data for the last 3 years for every hospital in England. And this really does enable someone from the NHS England down to tertiary care or secondary care hospital to benchmark with their peers to understand how they're performing and how they may be able to do better or learn from one of their peers who are doing better. We believe this is really important. You get to know your partner providers, you get real-time feedback on all providers across the system, and it creates an unbiased pictures of trends, variations, strengths, and weaknesses. In this way, you get to know your patients. So we improve patient and customer satisfaction, which can improve retention and acquisition. And you can really revolutionize the patient experience, implementing true value-based healthcare. We see one of the key gaps in the current market is that traditional surveys are biased. They're laborious to actually manage, and they just don't really get at the real-time insights that are left in the text-based comments. Those are typically the hardest to codify. And our technology automates this process, so you can actually have access to the insights in real time, as well as creating that sort of unbiased picture and democratizing the patient voice, allowing anyone to feedback on their care across the system. And in this way, we think it's really revolutionizing the way the patient experience can be seen and can be utilized by health systems across the globe, really. It's been an absolute pleasure and a privilege to be nominated and to win an award through the PDHA 2021. We are thrilled at our prospects in Europe and how our technology can really fit into the market and make a difference in our recovery road to recovery during COVID. And I really look forward to hearing from the next award winners and being inspired by their technology and innovations. Thank you for having me.
So that brings us to the end of this year's awards ceremony. I would like to congratulate everyone who took part, and in particular congratulate, of course, all the winners of the awards. But actually the submissions from everybody was of high standard, and it really shows how much creativity and innovation there is going on in this area. I'd like to thank everyone who's been involved, the Digital Healthcare Academy, Allied for Startups, everybody at MSD who's been involved in running these awards. It's been an absolute privilege to be involved, and I very much look forward to being involved next year. Take-home messages. Digital innovation is not going away. It's coming our way now. It's here. We need to make sure that we make the most of it for the benefits of patients. The potential is huge. There is potential in clinical trials, exchange of information to patients, how we diagnose, how we manage patients with illness, how we understand who is high risk, how we prevent disease in particular, and how we understand the spread of illness. So the potential for digitalization of healthcare is endless, and we need to make sure that we have an external environment that allows us to maximize the benefit from that. There are clearly issues around privacy and exchanging data that need to be looked at, but we need to ask our political colleagues to make sure that Europe can make the best of the digitalization revolution that's heading our way. So with that, I'd like to wish you all a good evening, and I very much look forward to running the award ceremony for next year, the 2022 Digital Healthcare Awards. But for the time being, thank you and goodbye.